Hello again. Checking in. I guess it's been 2 weeks since. No, it's been a little more than a week, I guess, since the last time I did a web video. I have had two doctor's appointments since that time. One was the following day, and then I just came back from another doctor's appointment this morning. Things are pretty stable. The muscles are moving not inward but slightly outward, which is what the doctor's looking for, so that's good. He told me that my eyes pretty much look straight, which I agree. When I look in the mirror, that's what I see. The problem I'm still having is inflammation in my eye that had the surgery. He said that it's unusual, not unheard of, to have inflammation last this long. It's been 3 weeks yesterday since the surgery, and it's still really inflamed. In fact, I'm still on the drops for another week at least. So I'll show you my eye. I don't know if you'll be able to see it. So still pretty red. It's actually migrated over toward the iris, which is not expected. Not a terrible thing, but it's not expected. So things are pretty much holding steady. One change from the last time is, instead of blocking my eye, they gave me something for my glasses. I don't know if you can tell. I guess so. It's a prism film that's put on my glasses, so that makes things a little bit easier for me. It doesn't make everything single. I'm still having double vision. Still don't feel like I can drive. I asked the doctor about that, and he said, well, I could drive if I wanted to cover one eye, and I don't know that I'm comfortable doing that. Pretty much create a huge blind spot when you do that. So, and I did try to drive wearing the prism glasses. It just made me nauseous. The problem with the prism glasses is that I can see singly when I first put them on, and then after a matter of about 30 seconds or so, it just goes back to double. Not as bad as without them, but it's still double. So I really can't drive seeing double. Probably end up crashing into something or somebody, so I can't really do that. So I guess at this point it's just holding steady. I'm told that the stitches are dissolving, so I feel a sensation in there. It's a little scratchy. I'm also doing exercises for the eye to help try to bring down that, to work out the muscle in the eye that had the surgery. So stretch it out a little bit, maybe settle it back in. But my eyes are still hopping back and forth. My brain's still trying to figure out what's going on. So right now it's frustrating, but it is getting better. In a small room, when I started out, I could hold my thumb out a little bit and see singly. I can do that all the way out now. So things within a room are starting to look single when they're going a little further out. So it's getting better, but still not where I want to be. My doctor's out next week, so I have an appointment in 2 weeks. So I'm hoping that I get to a point where I can drive in that time. And he said if I feel that way, I can go ahead and try it. He still right now wants me to cover one eye for driving, and I don't want to do that. I think that's dangerous. So I'm just going to still hold off for a little while and hope this inflammation goes down. I guess I'm one of the lucky ones. But I've seen other videos on here, and people have had problems that have been resolved, so I'm sure that's what's going to happen here. So if anything changes, I'll make another video. If it stays the same, then I'll just hold steady. So if you're having the surgery, I still don't regret it. I feel that it's the right thing to do. It's just that recovery is taking a little bit longer than I expected, and a little bit longer than the doctor expected. So if you're having it, don't let me dissuade you. It's still a good thing to do. It's just that this is one of the experiences that can happen, and hopefully I'll be able to post another video with it resolved. So if you're having it, good luck, and post another one when things are going well. Thanks.